Well, hello again. It's Dr. Hargroder with the mini gastric bypass. We're going to have a special topic today. I'm going to wait for Carla to join me, and we'll be talking about how to share the mini gastric bypass with your loved ones, friends, family members, people, that you might think would benefit from the surgery, but it's maybe awkward to bring up the topic. Carla's got a little method, a little technique that I think you'll find very helpful. So let's see if we can board. Hey, Carrie.
Yay, look
First
there.
time.
Yes,
Congratulations.
yay.
So, so while you were joining, I was just kind of mentioning the topic today. A lot of people welcome Carla. For those that don't know Carla Hubenthal, my patient care coordinator, and
Ah,
Carla's got a little presentation that she's done for me in the past, and I thought it was very powerful and helpful because there's lots of people that know somebody that they think, I've seen this person diet so many times. I've seen them struggle with their weight. It may be a relative, a brother, sister, or some other family member or friend, and you just don't know how to approach them because you certainly don't want to offend them, and it might be a bit
right.
awkward to talk about. Hey, I need to talk about the fact that you need to lose weight. But Carla kind of has the touch. And I'm going to let her explain a little bit more and turn it over to Carla.
Okay, thank you so much. I am so excited about the topic tonight. It is one that is very close to my heart. And I would like to begin by telling people why. Well, first off, many people probably don't know that I started my company in 1990 and I called it the Sleeping Giant Within. And just as you know, when you title a book, you start a company, it takes a great deal of thought to put into what you want to call it for life. And of course, then you have to have a mission statement. Where are you going with it? And most companies have this long page or a paragraph of what they want to accomplish, and then they narrow it down into just a few words. And we did the same. But when we narrowed it down, our mission statement was we build people. So that has always been my focus in life because I firmly believe all of us are here on earth to make a difference. And when you can touch the life of someone and help them to be better than they are today, that's what it's all about. And when I decided to have the mini gastric bypass with you, I had my angel, Margaret. Margaret was a patient who had had the surgery just a year before me, and I would talk to her by email on the computer. And finally, one day I said to her, "Do you mind if I call you? I wanted to hear that voice. I wanted to know she was real. I needed that human connection that makes us together." She said, "Oh, sure, you can call me." So I did, and we talked and talked, and even to this day, she is my angel Margaret. We chat on Facebook, we do birthdays, we do everything, and I will always be eternally grateful to her because she gave me the courage, that foundation that I needed to make that step to go ahead and have that surgery when others were trying to make me doubt. And so that's what I want to teach people to be able to do. Now, in order to do that, you're absolutely right. We have to overcome the barriers. Number one, we're so afraid we're going to offend someone. Like I didn't know I weighed 320. Please. I knew it. I was miserable in that 320-pound body. And if anyone talked to me about it, wasn't offended. So it's part of our fear and not their fear. So we have to overcome that. And we do that by becoming stronger and confident in who we are. And knowing that we're offering them an answer and a gift that's going to change their life just as it has changed ours. And when you look at it that way, it's so easy to share. It is just absolutely, it's like having a baby. You know, when you have the first person you have shared the MGB with, and they're getting ready for surgery, it's like waiting for that baby. And then the baby arrives, they have the surgery, and they're learning. They're learning the liquid diet, they're learning the soft food diet, and then all of a sudden they're on regular food. And believe it or not, we're afraid of regular food in the beginning because it's like, now what do I do?
Mm-hmm.
So you help this person every step of the way. And before you know it, they're toddlers, they're teenagers, they're out doing things, they're skydiving, they're just doing all kinds of miraculous things because they're happy and healthy. But that gratitude never leaves because you've touched that person's life. So let's talk about how to do that. Okay. First thing you want to do, and what I'd like to share is I have now added 1,750 patients to our surgery schedule in the 17 years. Proud of that? You bet I am. But what I'm proud of is that those people trusted me and made that human connection that allowed us to walk through that journey together. And I am so thankful for that. Yeah. And how you make that connection is you listen to them. You look to see, what age are they? Are they single? Are they married? Do they have children? Do they have young children? Do they have older children? Do they have grandchildren? Because all of that is tied into the reasons they want a better life. And so when you can learn to make that connection and hear what they have to say, you can help them see what the surgery will do for them and give them a better way of life. And you look for opportunities that will make you connect with real examples and stories. Perfect example is when I get on an airplane, anyone who sits by me, even if they're thin, they know someone who is battling their weight. And when I click that seatbelt, I always say to the person next to me, isn't that a beautiful sound? And they're like, yes. And they look at me like, okay. And then I share, well, I used to weigh 320 and I used to have to ask for a seatbelt extender. And now I don't have to do that. And that will start a conversation. And they'll say, well, you know, my mom really fights her weight, or my sister battles her weight. You never know who is going to be with who. Right. And so once you get the person to share, and you share a real life example that they can connect with, they'll start to listen to you. And then you can start to ask them, you know, are you a diabetic? You know, ask them what are some of the health issues that you fight? And they'll tell you. People are more than willing to tell you, and then you explain what the surgery would do for them. If they're diabetics, wonderful. Dr. Hargroder, you will be one of his favorite patients because Dr. Hargroder is going to take you off all of your diabetic meds the very next day, and 95% of our patients never return to them. All you need to learn is just a few tips about the surgery itself, And there's four basic ones I tell everyone. And they are: the surgery is performed laparoscopically with an overnight stay. Dr. Hargroder is going to create a slanted stomach pouch so you can easily digest your food. And I talk about we eat everything. And the stomach pouch is created out of the lesser curve of the stomach because it's less elastic, won't stretch over time, so you won't regain all of your weight. And they always go, oh my gosh, that's wonderful. And Dr. Hargroder will customize a bypass for you where all the calories are absorbed, making it a low pressure system. And our procedures easily reversible or revisable. They will also ask questions. They have heard of other procedures. They'll talk about, oh, I know so-and-so at my church. And they had, I think, the major one. So what's the difference? And then you explain the difference. If you don't know the difference, that's absolutely fine. All the things you need to know is our office phone number, which is 417-206-2900, and our website, which is www.mgb-surgery.com. That information there will give them the key to get all of the answers to their weight battle. Always carry before and after pictures with you. I have laminated pictures I can pull out of that purse in 2 seconds. All of us have hundreds of pictures on our phone. You don't want to be scrolling through 5,000 pictures to find your before and afters. Build an album with 3 pictures: your before picture, your after picture, and a picture of you doing something you couldn't do before having your mini gastric bypass. Those 3 pictures are absolutely invaluable. And all you have to do is open the album on your phone, show them the 3. You can shoot it to them in a text, and they'll look at it and go, oh my gosh, that don't look like you. I show everyone that before picture. Am I proud that I weighed 320? No, but I'm very proud that I had the courage to change my life and have the mini gastric bypass. And that's what you're sharing, is touching that life of others. And that's what it's all about. And all you have to do is make that human connection. Especially, for example, when people call. I had a lady call me today. Now, there is a reason that she picked up the phone and called me today. She attended a seminar I had done 4 years ago in O'Fallon. And she said, you know, I've never forgotten you. She said, and I think it's time. And she said, both my husband and I have had failed lap bands, and I'm tired of failing. She said, so I went, but there was a reason she called me today. And she shared that reason with me when you make that human connection. Yeah. And that's what it's all about. Then they will decide on how to schedule their dates and get everything in line. But it's amazing at how rewarding those phone calls are every day. Sure. What I do is so energizing, as I'm sure it has to be for you. When they come in after 1 week and they've lost weight, when they come in 1 month later, when we see them a year later and they're 100 pounds less, oh my gosh, yeah. That just makes your heart sing.
It is absolutely very rewarding, no doubt about it.
Yes, and it makes us do the things that we do. Now, let's also talk about when somebody says no, because people say no to me. Not everybody says yes to me. I have learned over time that sometimes it's just not the right time. And to take that no, there's a book that I just love the title. It's called The Beautiful No. And when I hear no, then I go, oh, okay, that's my beautiful no today. And so then I know when I talk to someone else They might be my beautiful yes. So that's what keeps you doing what you do. And the same way for all of us. If the first person you talk to says, no, I don't think that's for me, that's fine. You have planted a seed, and it may take time to grow.
Right.
Just like the woman who attended the seminar 4 years ago. That seed has never left her. And yes, it took time for it to grow and make today the day that she made that phone call.
Right, right.
But it's wonderful to touch the life of those people. So, okay, let's back up and look at just the things that we need. We need 3 pictures on our phone in an album, before picture, after picture, and one of us doing something we couldn't do before. We need to know the phone number of our office and the website, so they can go on the website and they can view the video series, or they can register for the live webinar tonight at 7 p.m. Central Time.
Yep, absolutely. And the other thing too, you talk a lot about you initiating through your own words, but I think sometimes you can find the opportunity to share your experience just with somebody's else's own words. Someone's struggling with their weight, and they bend over and they get up with or some aching pain or something, and
Yes.
it's like, man, it's sad to see you struggle like that. Have you ever considered, or have you thought about doing anything about it? Little things like that just looking for those little opportunities to engage, particularly friends and family. Maybe not go up to a total stranger and do that, depending on where you are and what the circumstances are. But I think there's lots of opportunity. It's interesting. The part of the reason I wanted to do this one is so many of our patients are referrals from other patients, right?
Yes.
And that's where we get many of our patients are from other patients that have had the surgery, and they share it with others. So they're already pretty good at it. But I thought it was nice to be able to have this little refresher course to remind people to not look upon it as I am being critical of this person or I'm judging this person. You have to look upon it as I love this person and I care about this person and I really want to help this person. And it can be very calm, benign, non-judgmental words that you speak just to open a crack in the door to see if they will engage and if they have any interest. And if they're not interested, well, then it's not for them. But sometimes you'll miss an opportunity to share this with someone that would really benefit just because of the fear. And I think I just wanted to be able to have a little bit of a talk to help people overcome that fear of that initial encounter.
Yes, because on the other side of that fear is gratitude that you've touched a person's life.
Right.
And that stays with you forever.
And you might not be able you might not get to enjoy it if you never overcame the fear. Then you don't ever receive the gratitude back,
Yes. Absolutely. And again, you only keep that which you give away.
Right.
Somebody wrote something I could see.
Yeah, can you read it?
No, it went by too fast.
Yeah, Carrie's writing, how do you still be encouraging to others when you yourself have had struggles? I've had plenty of people talk to me about the surgery, and I try hard to remind them that my issues aren't common, and every journey is different. But they mostly all say, don't think I could ever go through what you have. And Carrie, there are, every once in a while, fortunately, it's not common, but some people don't have as good an experience as others. Some people have had other types of surgeries. I think that's the biggest thing to overcome is people who respond with, oh yeah, I know about that surgery. I have a neighbor that had that surgery. Well, no, they didn't have our surgery. They had,
Right.
something else that typically has oftentimes a lot more complications with it. But I think, even if you've had complications, and I don't know the particulars, we'd have to have a conversation about that. But it's still the weight you've lost over the years should be something that, I mean, the thing for people to understand is complications can be overcome, difficulties can be overcome,
Yes.
but your weight staying at 300, 400 pounds isn't going to go away, and your health is only going to deteriorate. If you have problems with your weight loss surgery, well, then you need to be in touch with your doctor so that you can then be coming up with a plan as to why am I having problems? What do I need to do to not have problems? And typically that can be overcome, whether it's with medication, maybe just some behavior modification, maybe even revision surgery as a worst case scenario. But I think in any case, you can generally find the way, particularly with those people that are, 100+ pounds overweight that are just not going to get any better. So it's like, well, I could have this surgery that does have some risks, but they're relatively small risks, or I could continue to live my life knowing that statistically I've got a significantly higher chance of developing diabetes and sleep apnea and high blood pressure and having a stroke or a heart attack and unfortunately, dying a premature death.
Yes. Well, and I remember just a few weeks ago when we were talking about a certain topic for the Facebook Live, and I said to you, where would I be today had I not had the surgery? I did not expect the answer you gave me. And I have to admit, in front of everyone, it floored me when you said you would probably be in a cemetery. And I was like, and because I will never forget what it was like to weigh 320, especially that last year. The painkillers, the muscle relaxers, the always, not can't do this, can't do that, everything hurting, versus how I feels these last 20 years. You don't forget that.
Right.
But when you said it that way, it was just like,
Well, I know
wow.
I felt like I owed you an apology because I was a little too abrupt with that, but it was sort of, it
No.
was reflexive, it just, you
Yes.
said it and I said
Yes.
what Osawik oftentimes, accuses me of saying the first thing that pops into my brain, which
But
sometimes isn't always the best thing, but
you know what? It was so true and so real. And even on our slides, it says the average life expectancy, the extension is 13
yeah,
years. And I'm always teasing you, I'm on 20. What am I on borrowed time or what? But truly, in all heartfelt honesty, it is the most wonderful changes ever.
sure.
And so grateful that everyone has absolutely trusted me to do
I
that.
want to see before we wrap up here. Pam Wolf is on. Pam, I don't want to put you on the spot, but if you would like to join us and just tell your version of your encounter, because she's kind of got a similar story. I'm going to send you an invite. If you don't feel comfortable coming on screen, you don't have to. But I'd kind of like to hear about your experience because she wrote that she had a friend that had had the surgery and did beautifully, and her encouragement helped her to have it.
Yes.
So I'm going to see if this will work. Sometimes it's not her not wanting to go on; it's just Facebook not
Right.
wanting to cooperate. So
Right.
we'll see what
Don't we know?
happens here.
Yes. 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 Yes.
All right. Well, we're going to give this another minute or two, and It doesn't look
Okay.
like Pam's going to be able to join us.
It won't let her.
Well, I'll tell you, I'm going to cancel that because she would have answered by now. Pam, if you want to join, hit your request on your end, or anybody else for that matter that would like to tell their own story. We'd be happy to hear from you before we close this session out. And so I'm waiting. We'll give it another 30 seconds or so to see if she pops up. But while we're waiting, I think, don't be afraid. That's the message. Just don't
No.
let fear prevent you from potentially helping a loved one, a friend, a family member by just casually mentioning it. I always think one of the biggest mistakes some patients make is not telling anyone that they've had the surgery.
Right.
Because to me, that actually increases their level of pressure and anxiety and everything, because now everybody's worried they're sick. Do they have cancer?
Right.
You've lost all of this weight. There must be something wrong with you. And if you're not willing to say, no, I had the mini gastric bypass and it helped me to tremendously to get healthier, then I think you're missing out on a real opportunity. So. Well,
Very
listen.
much so. And you only keep that which you give away. So, yes.
Yeah, absolutely. Well, Carla, I want to thank you again for another great session. I will see you in about 25 minutes
You
at
bet.
the webinar, and then we'll do this again maybe later in the week, but for sure next Tuesday at 6 o'clock, or plus minus 5 or 10 minutes, depending on how my schedule allows. That's Central Time for anybody that wants to check us out next week. Carla,
Thank
I'll
you,
see you in just a little
everyone.
bit.
Share the
Yeah.
MGB.
Hey.
Yes, share it with everyone. Bye-bye.